When you consider health services in the United Kingdom, the vast majority of people who are using health services are adults. So adult nursing really prepares you to work with that client group. We've got nurses who work in general practice, in community settings, in prisons, in workplaces, doing occupational health. There are just endless opportunities for students in terms of future career options.
Northumbria University is definitely one of the best places to study nursing. We win awards, we are second in the league tables at the moment. We offer all fields of nursing practice and it's a great place to learn and get some hands-on practice. We are at the top of the league table for the North East, so my answer would be, why would you go anywhere else when you can go to the best?
In the adult nursing course, students spend 2 days a week in university. They will have lectures, seminars and clinical skills practicals, some which will be using our simulation suites. Teaching will be delivered by registered adult nurses, where they're getting taught by people who have got many, many years of clinical experience across all areas of adult nursing. 50% of the programme has to be theory and 50% of the programme has to be practice. So by the end of 3 years, all students must have completed 2,300 clinical hours to register.
I get out of placements, new experiences, lots of learning, meeting loads of great people, meeting members of staff. It's definitely the interactions with the patients and meeting the families and getting to care for the patients and be involved in their care, and also being like a member of staff, not just like a student.
And everyone was so welcoming, made you feel part of the team, and just getting to know the patients was really nice as well. And just being able to see loads of different things that you wouldn't even expect to see and do.
Over the last couple of years, Northumbria University has invested really heavily in virtual reality and augmented reality. The fantastic thing about that is it provides learning experiences in our safe environment on campus that feel realistic. The benefit is, and what we really hope our students do, is they make a lot of mistakes in these spaces, and it's from there that we pick up the learning as well. So we use VR to teach anatomy and physiology. You can deep dive into someone's body. You can look at the pathway of an oral tablet and follow that into the esophagus, the stomach, the intestine. The other thing we can do is provide some really quite sensitive scenarios within virtual reality, so thinking about safeguarding or perhaps preventive terrorism, things that are difficult and challenging, so that when you're out in the real world, you're ready for the challenges that you're going to face. We also do a lot of simulation-based education, and that's really bringing in that experiential learning for our students. That means that we're working sometimes tabletop simulations, sometimes alongside mannequins. And again, we're testing students, allowing them to trial things so that they're prepared for that real-world impact.
We've got a strong emphasis on the development of practitioners who are safe and effective, and we use things like simulation in order to get the students to experience relatively rare but potentially catastrophic events. I think the course really is helping the students develop those skills, but more importantly the confidence to become registered nurses.
OSL's online supported learning, and I like to use them again to read up on things before class so I know what we're going to be covering in lessons.
Also as well, if I go through it and there's anything I'm struggling with, I can ask a question and get feedback from my lecturer. Also if I've missed anything as well after, and I can recap my learning and then use it for revision.
We understand that you'll naturally be a little bit anxious about starting to study again at university, and the whole team are here prepared to help you get to grips with study, get to grips with writing your first assessments.
The quality of teaching is very good. They always respond to emails, they always put things in place. If you're ever struggling, they will do anything they can to help you, and they're always here if you need support. At the start I was really nervous and I was scared, I didn't know what to expect, but all the staff were so welcoming. I've made some great friends, I've had a lot of fun, I've learnt so much and I've enjoyed all my placements, and it's been overall really good.
When I support other people to feel good, to do good, that makes me feel good, and that's what keeps me doing it.